Good day, I'm Samantha Jane Ross from BSN 3C, and in today's procedure, I'm gonna perform surgical hand washing. The purpose of this is to remove or deactivate all natural skin oils, hand lotions, and transient microorganisms of those who will attend sterile situations. The equipments needed are antiseptic soap, antiseptic agent, running water, soft stick with pinpoint end or brush, and hand towels. The goal of care of this procedure is that the hands will be free from visible soiling and transient microorganisms will be eliminated. For the assessment, we need to assess client care situations such as procedures in the OR like removal of the gallbladder. Next, we need to examine our hands and forearms for cuts and or visible blemishes and ensure that the fingernails are in good condition and no longer than the fingertips. We need to gather all the materials needed to save time and effort. We also need to prepare ourselves, such as putting on our surgical attire, and for the girls, tie up their hair like this, and putting on the surgical cap and surgical mask. Like this. Then we need to ensure to remove our watches and rings or bracelets, and we need to ensure that our nails are free from nail polish and artificial nails, and it must be clipped. Now for the implementation, we need to turn on our faucet and adjust the temperature and rinse our arms using the backward stroke from elbow down to the fingertips as we consider the elbow as the cleanest. Now apply a liberal amount of soap and scrub our arms and hands, making sure not to go back onto the area where you have already scrubbed it. Now rinse it from fingertips down to the elbow, making sure that your arms are still in the above elbow level. Now pick up your stick and clean the underneath of the fingernails to remove all the debris, and rinse it. Now wet your sponge and apply a liberal amount of soap and scrub your non-dominant hand. Your fingernails must be scrubbed 30 times using a circular motion. We use circular motion in order to remove all the debris and to ensure that all sides are thoroughly scrubbed. For the side of the thumb, 20 strokes. Posterior aspect of the thumb, 20 strokes. Sides of the fingers, 20 strokes. And back of the hand, 20 strokes. We need to ensure that all sides are thoroughly brushed, especially those areas where you wear your jewelries and wristwatches. Then using the same stroke, 20 strokes for the forearm, consider your arm as a rectangle and it must be scrubbed in all four sides. Then repeat the same procedure onto the other hand using similar stroke for the nails 30, side of the thumb 20, palms 20, posterior aspect of the thumb 20, sides of the fingers 20, and back of the hand 20. Again, we must ensure that if we have already scrubbed the area, do not go back to prevent the transfer of the germs. Next, our arms, 20 strokes. Making sure that your arms are still at above the waist level area, and making sure that we are not touching anything from the sink. After scrubbing, rinse the sponge and place it back into the container, and rinse your arms from fingertips down to the elbow. Making sure not rinsing your arms back and forth into the water. Now for the other arm. Now walk into the area where we placed our sterile towel and allow it to unfold. And wipe the hands and arms from fingertips down to the elbow, making sure not to go back. And after that, walk backwards into the OR. We walk backwards into the OR in order to prevent the germs from transferring onto our surgically scrubbed arms. Now document the procedure.